Health is wealth, and the nation's prosperity and progress is owed in large part to its human resources put to work and good use. PTV correspondent Pauline Requesto on exhortations by the World Health Organization to invest substantially more on more affordable health care at the grassroots level in this report.
The World Health Organization urged the government to strengthen the country's primary health care system. According to the WHO, the government should invest more on the primary care level to ensure that all citizens receive quality health services.
Sits closest to the community, and it is the place they offer the screening for common diseases. It is a place where they can receive the preventive services such as vaccination. It is a place that people can get the regular checkup, such as a pregnant mother and newborn baby.
The WHO noted that 1 of every 3 Filipinos die prematurely or before the age of 70 because of non-communicable diseases such as heart disease and diabetes. These premature deaths, according to WHO, could have been prevented had the conditions been detected much earlier and the patients given the treatment they needed at the primary level. The challenge now for the Philippines is obtaining a people-centered healthcare system, which entails accessible health services where and when people can avail of them despite financial constraints.
They are bypassing the primary healthcare level, the barangay health station or the rural health unit, because they believe that if they want to get proper care, they just go to the professionals straight away. As a consequence, we see that many hospitals are overcrowded, and many hospitals, even tertiary care facilities, are treating people that could be very well taken care of at the primary healthcare level.
The WHO said the enactment of the Universal Healthcare Law is an initial step towards a strong primary healthcare system. The Department of Health said there are about 20,000 barangay health stations and rural health units all over the country which can provide health services at the primary level. Through the UHC, the DOH aims to improve these health facilities and increase the number of health workers. The DOH is currently drafting the implementing rules and regulations of the Universal Healthcare Law.
We want to make sure that the primary care services are up to par, that they have good quality, and of course that they are manned by adequate staff and by competent doctors and nurses and other health workers.
Among the provisions under thorough discussion are funding and a new system of service delivery. The Health Department targets to finish the IRR by July. Pauline Requesto for The Nation.
Beyond the headlines,
it's news with a different perspective.
Before the day ends,
for events that shape our views and impacts the world around us.
we keep you up to speed.
With Richmond Cruz and Charms Espina. PTV News Headlines, your comprehensive nightly news source, only here.